others can join in as they arrive. Migrant Clinicians Network and Farmworker Justice are pleased to present this webinar today. Presenting for today's session is Dr. Maeve McMurdo from the Cleveland Clinic and Daisy Marino Gonzalez from Vista Community Clinic in Vista, California. Next slide, please. Just a bit about Migrant Clinicians Network. MCN is a force for health justice, and our mission is to create practical solutions at the intersection of vulnerability, migration, and health. Next slide, please. Farmworker Justice is a nonprofit organization that seeks to empower migrant and seasonal farm workers to improve their living and working conditions, immigration status, health, occupational safety, and access to justice. Next slide, please. This presentation is being simultaneously presented and interpreted into Spanish. To view the Spanish slide deck at the top of your screen, there is a tab labeled View Options. Click on that View Options tab, and a drop-down menu will appear where you can select either the English or Spanish presentations to view. Likewise, at the bottom of your screen in the Zoom toolbar, there is a globe-shaped interpretation icon. Click on that icon and select the language you would like to hear. We'll give you a moment to do that. Great. Next slide, please. Looking at our agenda for this session today, we're beginning with some introductory information, followed by I'm seeing this Spanish slide deck here, so I'm just translating in my own head as I'm watching this. Followed by a setting of context by
Rebecca,
Amy
why don't you
Liebman.
just go up to the view option so you don't have to translate, and just make sure you're clicking on the English slide deck.
Oh, thank you. Thank you for that. It switched on me in the middle for some odd reason. Sorry about that, everyone. Then we'll be moving on to Dr. Maeve McMurdo's presentation on wildfire smoke and farm worker health. We'll follow that with Daisy Marino Gonzalez's presentation on emergency preparedness. Then we'll have some information on resources and a brief evaluation. Next slide, please. Finally, an acknowledgement that this webinar is supported by HRSA, a division of the U.S. Department of Health and Human Services, and that the content of this presentation are those of the authors and do not necessarily represent the views or is an endorsement by HRSA, HHS, or the U.S. government. And with that, I will turn it over to, next slide, please. We do have a few objectives that will be shared today. We'll be learning about wildfires in the U.S. and how they affect farmworker communities. We'll identify the effects of wildfire smoke on the health and well-being of farm workers. And finally, we'll be exploring resources to help farmworker communities better prepare for wildfires in their home communities. Next slide, please. I'll be turning it over now to Amy Liebman of Migrant Clinicians Network, who will be helping to set the stage for today's presentation.
Thanks so much, Becca. Hi, everyone. This is Amy Liebman from Migrant Clinicians Network. And I just wanted to probably tell you something you already know, but this is Washington, D.C. This was Washington, D.C. last year. And for probably the first time in my memory, a good deal of the East Coast was suffering from poor air quality as a result of wildfires that were happening in Canada. And our air quality reached very dangerous levels, and we were encouraged to not go outside and to stay inside, particularly those that maybe had some chronic conditions such as asthma, or people who were doing exercise. It was suggested that we perhaps stay inside. And I think that that's wonderful advice. And although I wasn't in DC, I was near DC and it was impacted by that. and I had the means to be able to make those decisions. I understood the messaging because I spoke English. The messaging was in English. I have the luxury of being able to work from my living room, which I'm doing right now as I'm speaking to you. I didn't have to go outside. I didn't even have to go outside to get to work. And I chose not to go outside to exercise. But those are some things that not all of us have those kinds of that option to make those kinds of decisions when we're dealing with the impact of wildfire smoke. At the beginning of this month, I've been on vacation quite a bit this month, luckily. I was in the Lincoln National Forest hiking. It was absolutely stunningly beautiful. And just last week, I read about all the evacuations that were taking place in Ruidoso, New Mexico, due to out of control wildfires. Again, I was vacationing. I had the option to be in the Lincoln Forest or to not be in the Lincoln Forest. Should something have happened when I was there, I did have the means. I had gas in my car and was able to leave. But this is not always an option for all of us. Next slide, please. And today we'll be talking about farm workers and wildfires. And I just wanted to leave you all with this quote from Eric from the United Farm Workers. And his point is that there is nothing heroic about what we do. We work out of necessity. And Eric was talking about when he had to continue working, as you can see in this photo, during the wildfires that were taking place 2 years ago in the Northwest. So not everyone will have the ability to make the kinds of decisions that I was able to make during two separate wildfire events. And so when we think about our farm worker population and the challenges that they might face during wildfires, the type of preparedness and the type of communication and the type of work that we all need to do becomes very, very different. And I think that we have two fabulous speakers that will help us understand the impact of the wildfire and also think about ways that we can help our farm worker population. And with that, I'll turn it back over to Rebecca.
Great. Thank you so much, Amy, for sharing that information and also for this really impactful quote and photo. And now we will turn it over to Dr. Maeve McMurdo, who will share with us more information on wildfire and smoke and health. Thank you, Dr. McMurdo.
Thank you for having me, and I am very glad you guys are hosting this seminar. As I think we're all experiencing, wildfire smoke is really becoming a summer problem across the United States. It's not just California, it's not just the West Coast. I think there's still a lot we don't know about how it impacts health, but hopefully I'm going to get some information today that can kind of help to frame the discussion and provide some kind of action points or calls to action. So I'm a pulmonologist, a lung doctor over at the Cleveland Clinic in Cleveland, Ohio. I work a lot with our farm worker community here in Ohio and partner with an organization called OLA Ohio to really look at farm worker health in Ohio, which again is different to the West Coast and faces a lot of barriers. And the goal today is really to cover a couple of things. Next slide. I'm going to talk a little bit about some background about kind of what's happening with wildfire smoke or what the trends are and what we're seeing and how that's impacting air quality. We're then going to talk about really what makes wildfire smoke different and why we worry so much about the health impacts of wildfire smoke, also what we don't know about how wildfire smoke impacts worker health. And then kind of, again, finish off with talking about what we can do and really some practical steps, thinking about kind of broad needs to protect workers and protect farm workers. Next slide. So I think the most important thing to kind of start with and frame is that we know that wildfire season is starting earlier and it's lasting longer. We are seeing a significant increase in the amount of area that's being burned by wildfires across the United States since the 1990s, with a wildfire season that's now occurring every year and lasting for a whole lot longer than it used to. So we're seeing a longer period of wildfires. We're seeing wildfires burn more intensely, and we're seeing wildfires impact areas of the United States that weren't previously impacted. So we're seeing more spread. Next slide. What that means is that we're seeing changes in air quality. So with the United States, we'd actually made a lot of progress in improving our air quality with the Clean Air Act. And we've seen really across the board, though there are some exceptions, a decrease in fine particulate matter, PM2.5, concentrations throughout the United States. And what we've seen now the past really 5 years is that with wildfires increasing in intensity and increasing in how long they're burning for, that trend is being reversed. For the first time in almost 30 years, we're seeing concentration of PM2.5 across the United States starting to increase, and particularly in the West Coast, but also in the Mountain West, increasing in the Southwest, really across the board. We're seeing that progress slowly being chipped away. And so the air quality is really worsening for everybody, and that's being driven primarily by wildfire smoke. Next slide. I know that many of you are coming from the West Coast, but I want to highlight this map, which was taken, I think, earlier in June. And this is showing the active wildfires burning across the United States and Canada at a single day point in time. And what you can see is that while the big red dots show the really, really intense wildfires, there are smaller wildfires throughout the entirety of the United States, and these are burning now almost continuously. Since I took this snapshot, the area has increased. We're seeing more wildfires starting in Oregon. We're seeing more wildfires across the sort of British Columbia area. We're seeing wildfires again in Quebec. And so what that means is that we're going to see this significant change in air quality, which really impacts people who are outside, and particularly impacts farm workers who often have no choice but to be outside. Next slide. This is really important because we know that exposure to poor air quality impacts health, really starting from before you're born and extending throughout your life. So poor air quality or exposure to air pollution has been linked to low birth weight, to early delivery. It's strongly linked to childhood asthma. And then as we get older, we see an increased risk of heart disease, of stroke, of high blood pressure, of chronic lung disease like COPD, like asthma. High blood pressure can impact sprinkling, which is probably less important, but also just increases the risk of early death. And so when we think about kind of health and health across a lifespan, air pollution is probably one of the most important drivers of poor health. And it's something that often we have very little control over. We can't stop breathing, and we can't often individually impact the air we breathe the way we impact other risk factors for health, like diabetes or high blood pressure. Next slide. I want to talk a little bit about what I say when I mean air pollution, because I think it's important. And so when we talk about kind of air pollution more broadly in terms of health, we really think about air pollution as kind of being two key sort of subgroups. One is particulate matter, which is things like PM2.5, that fine particulate matter, extending things like coarse particulate matter, so things like agricultural dust, like silica, those kind of bigger dust that can also impact the lung. And then also things like gaseous compounds, so ozone, nitrogen dioxide, sulfur dioxide, carbon monoxide, all of which also impact health in really important ways. Classically, when we think about what drives air pollution, everyone imagines a sort of big polluting factory, and that is a major source of air pollution globally, as well as like traffic, cars, vehicle exhaust. But from an agricultural setting and from a sort of farm worker setting, there are already other important drivers or causes of air pollution exposure. So we think a lot about agricultural dust and just the dust which is generated by doing farm work, which is potentially dusty, particularly in areas where there's experiencing drought. Anything like tilling the soil, like plowing the soil, can release significant dust into the air. And that plus wildfire smoke is not a good combination. At the same time, things like crop burning or waste burning also release particulate matter. They release volatile compounds and fumes, which again can impact health. And these things all add up. So when we think about the impact of air pollution on health, it's not just the wildfire smoke, though the wildfire smoke is really important, but also all the other stuff that's occurring at baseline that a worker might be exposed to. So for a farm worker who's working in an agricultural setting, this wildfire smoke really just adds insult to injury. It's one more layer of air pollution exposure in a job that already has a level of air pollution exposure, which is often under-recognized. Next slide. I promised to talk about what makes wildfire smoke different. I think it's important to recognize that, often we talk about PM2.5 and the AQI, the Air Quality Index, as one sort of big, broad number. But there's increasing data coming out from the literature that wildfire smoke may be more harmful than normal air pollution. We think that because of the way wildfire smoke is generated, the way a fire burns, you get a lot more carbon released into the air. And when you inhale those carbon compounds, so basically burning wood, it creates more oxidative stress and basically more inflammation within the body. And so things like high blood pressure, like high blood pressure, heart disease, all the sort of more cardiovascular complications of air pollution may be more risky with exposure to wildfire smoke because it is just more inflammatory. It basically triggers the body more. What's also important is really where the wildfires are occurring. So historically, a lot of wildfires have occurred in areas that are pretty isolated. So really those dense forests. But as wildfire season spreads, we're seeing more and more wildfires that we call the wildland urban interface, basically the area where forest meets suburbs. And when that happens, and when a fire occurs in that area, we see that the fire impacts not just the forest, but also it burns houses, it burns garages. And when we burn the stuff that's inside a house, we release a lot more other toxic chemicals that aren't in normal smoke. And those chemicals can interact with the other components of air pollution in ways which are pretty significant and can make you a lot sicker potentially than just being exposed to air pollution alone. And unfortunately, what we're seeing is probably more and more of these wildland urban interface wildfires, particularly in California and across the West Coast, because people are moving out and spreading out, and wildfires are spreading in at the same time. Next slide. When it comes to data about how wildfire smoke impacts health, unfortunately, there's not a lot of long-term research, and that's really a big gap in the existing literature. We know that in the short term, so right away when you're exposed to wildfire smoke, we see an increased risk of breathing problems. So an increased risk of asthma and asthma exacerbations, particularly in children. So children under 5 are really, really vulnerable to this, but also in the elderly or people who've got underlying asthma or COPD. When they're exposed to wildfire smoke, their risk of having to go to the ER, of requiring a rescue inhaler, of requiring more medication increases significantly, up to 80%. And so this is a really, really strong driver of poor health. Across the board with children, we worry about wildfire smoke exposure. We know that it basically impacts asthma control. And even when the wildfire goes away, so after the really bad smoke day, that risk keeps on going. So children and farm workers who are living in these rural areas may have symptoms that last and last and last because the wildfire smoke keeps on flaring up their asthma. People who've got COPD, chronic obstructive respiratory disease, can also develop, again, worse symptom control with wildfire smoke. They can have flare-ups, they can require medication. And even people who don't have lung problems can feel short of breath, they can have chest tightness, they can develop pneumonia more frequently, they can start coughing and wheezing. And the longer you're exposed, kind of the more intense your exposure is, the greater that risk really is. Next slide. We also know that wildfire smoke can impact the heart. I think this is really important and often under-recognized, particularly people who may have underlying stuff like diabetes or like high blood pressure. They are increasingly vulnerable to the wildfire smoke exposure. We've had several studies now showing that after a big wildfire event, the risk of going to the ER with an acute cardiac event, so a myocardial infarction, increases. And particularly in areas where there's high heat and wildfire smoke, that risk is probably higher. The data is not as strong as respiratory data, and this is a really challenging area to study because people often change how they behave during a wildfire event. They try and avoid leaving the house, they try and avoid going to the hospital, and so there's some confounders here. But we do have enough data that we can say pretty strongly that people who have underlying heart problems or are at risk for underlying heart problems should be really, really careful about avoiding wildfire smoke. Now, that's easy to say, but the reality is that for a lot of farm workers, that's not feasible and that's really hard to do. And that's where the challenge comes. Next slide. In terms of long-term exposure, I flagged this earlier, but we really have almost no data right now about how long-term, so exposure over years and years and years, to wildfire smoke impacts health. The best data we have comes from wildland firefighters. So basically firefighters who only respond to wildfires. And in these firefighters, we've seen an increased risk of lung cancer and heart disease. So again, that data is not that strong. It's kind of concerning. Now, wildfire firefighters are a little bit different from the general population. They're typically extremely physically fit. They're working right by the wildfire. So they're in this really, really high smoke exposure area, but also working seasonally. So they're kind of off and on and off and on. So their exposure is really unique. And that's a challenge because we try and take that data and apply it to farm workers who might be exposed again and again and again over a long period of time. Their exposure is different, and we can't necessarily say they're the same. And definitely they're not the same as the general population by any matter. There is some data coming out, and one really concerning study looked at basically people who are pregnant during wildfire smoke events and found that women who were exposed to high levels of wildfire smoke during their early pregnancy were more likely to either have gestational diabetes, so high blood sugar, later on during their pregnancy, which again, I think just really highlights that there's a real need to understand what this is doing to our health, not just in the short term, but really in the long term, particularly for groups like farm workers who are really, really exposed and often can't necessarily directly change their exposure in the moment. Next slide. There is currently no literature about the health impact of wildfire smoke on farm worker health. So this is a major, major gap. And it's one that several of us are working to address. But right now, there's a lot of sort of blank gaps and things we don't know. But what I will say is that we know that farm workers already have a lot of exposures and risk factors which make them more vulnerable and that increase risk from harm from wildfire smoke. They're working outdoors, which again, you're exposed to the most wildfire smoke when you're working outdoors because wildfire smoke is most concentrated in the outdoor air. You're doing physical labor and you're breathing fast because you're often, again, doing things that involve lifting, carrying. And the more you breathe, the faster you breathe, the more wildfire smoke you're actually getting into your lungs. We're also exposed to other stuff which may make you more vulnerable. So things like high heat, things like pesticides, things like dehydration, which can increase the risk of cardiovascular disease and increase heart or impact heart health. You may have underlying lung conditions which you may not know about. Again, we're thinking about farm workers and asthma and farm workers and COPD. Our group's done some work, and there's been some work group by the Davis group showing that farm workers have a lot of respiratory symptoms. They cough, they wheeze, but they often aren't diagnosed with asthma or COPD because it's hard to get to a doctor and it's hard to get breathing tests. And so if you don't know you've got a lung problem, what does that mean when you're being exposed to this, again, irritant, which we know causes lung damage? And so this is a major concern and a big gap we need to address. And again, like I mentioned, it's not just the wildfire smoke. So the actual work of farming generates dust and generates air pollution, which can combine and over long periods of time also impact health in important ways we really don't understand well. Next slide. We do have some really important and kind of scary looking predictions about what the future holds. And this is a great study from Marley et al. Looking at basically modeling out what's going to happen as we see increases in wildfires and increases in heat over the next year, kind of 20, I think 30 years. And what we've seen is that really the amount of farm workers who are impacted by wildfire smoke and impacted by heat is going to steadily increase across California, but also across the United States. Like I think someone mentioned in the chat, this is really a global problem. Smoke from Canada impacts the United States, smoke from the United States impacts Canada. Even at a state-by-state level, what one state is doing may have really important implications to the state next door, and so air pollution, again, travels. We know that farm workers have a hard time accessing healthcare, and farm workers often face a lot of barriers to getting the help they need. And there is a concern that unless we are really active about addressing this and looking at the health impacts, farm workers may be suffering from lung disease driven by wildfire smoke that's not recognized and not diagnosed and not treated, which is also really important. Next slide. So what can we do about it? And I think the most important thing is we really, really need policy that's going to protect farm workers from high smoke days. And there is a really strong need for a federal policy around air pollution exposure that actually applies to farm workers and includes farm workers and is enforced, because a policy that's not enforceable doesn't do a whole lot. And there's a worry, particularly with farm workers, that often policies which are generated for the general workforce don't apply to farm workers or aren't applied to farm workers as fairly. California has made some really huge steps in terms of regulating this and has developed a standard for wildfire smoke. And that standard basically mandates that when the AQI, the Air Quality Index, is greater than 500, farm workers have to use a respirator or be provided with a respirator. And above 150, have the option to use a respirator. It's a good first step. I would argue it really doesn't go far enough. And I worry a lot that this is not necessarily actually being done in the field. I think this is one of those things where it's very hard to enforce, and also maybe not enough. A respirator alone is not going to protect you from all that smoke, particularly when the AQI is 500. That's an extremely high level. I think it's also important to recognize that smoke from outside comes inside. And thinking about farm worker justice more broadly, housing is a major driver of the indoor pollution experience. So basically, the better your housing quality, the less air pollution gets inside. If you're living in poor quality, crowded housing with no ventilation or no air conditioning, you're getting a lot of that wildfire smoke coming in. And so staying inside may not actually improve your health that much more than staying outside. Air purifiers are really effective. They can be expensive and they require electricity, but they are a really easy way to improve indoor air quality, which can also, again, improve health. And so there are some things we can do about this. But I think the most important thing from my standpoint is really thinking about how we actually mandate protection for farm workers, because they are a vulnerable group who's highly exposed. Next slide. So in summary, wildfire smoke is a major and growing driver of air pollution, and probably the biggest change to our air quality in the past 5 years. We know that it impacts health. We know the more that you're exposed, the longer you're exposed, the worse those impacts are. And we worry that farm workers may be facing exposure which is impacting their health and just not well recognized, and right now, not addressed. And so my big ask, sorry, not a small one, is policy and action to really protect farm workers from wildfires. And so I'm really glad we're hosting the session today. All right, I think I'm on time, Rebecca, but thank you guys for your attention, and I'm happy to take any questions. I think at the end is what we're planning. Is that right?
Yeah, no, thank you so much, Dr. McMurdo. I will ask you just one quick question that came up in the chat, and then we will leave some more time at the end of, toward the end of the webinar for additional questions. But a few slides ago, you mentioned an 80% increase, and the person posting here, the question was wondering, was that regarding ER visits or medication needed?
Medication needed, so rescue inhaler.
Excellent. Thank you so much. That was a fantastic presentation. So much interesting, alarming, and some hopeful information too that you shared. So thank you for that. And we'll now turn it over to Daisy Marino Gonzalez, who will be presenting from Vista Community Clinic. So thanks, Daisy. I'll leave it in your hands now.
Thank you, Becca, and thank you for the amazing presentation. I am Daisy Marino. I'm from Vista Community Clinic, and I am the program manager for Migrant Health and Outreach Services, and we work a lot with farm workers, assisting them and connecting them to resources, to our services, as well as any other additional resources that we leverage through grant funding. Can you please switch to the next slide, Martha? Yes. And we, just a little background on where we are located. So I am from the San Diego region. So there's a map there that kind of outlines what is at San Diego County. I learned that we are the 5th most populated county in the United States. We're also located in the southwest corner of the California state. And we're actually really close to the border, the Mexican and the US borderline. So because of this, there are a lot of different challenges and barriers that families experience, specifically farm workers, and a lot of them come from mixed status families. So that represents an extreme barrier and challenge in terms of them feeling safe or having access to resources. If we go to the next slide, please. For the purpose of this today's presentation, I'm gonna share a little bit about some historical context about wildfires in San Diego County. I'm gonna share a little bit about the programs, my program at VCC, and some of the work that we have done, as well as a few tips that we usually share with families. In 2007 in San Diego, there was a big wildfire that lasted 10 days. And it was 8 different fires happening all at the same time. They burned a lot of acres. They also destroyed a lot of homes and businesses. And up until today is one of the events that a lot of the farm workers always refer to as being a very impactful and painful time in their lives, given that the devastation that it brought to their families and their homes was worse than what the rest of the community experienced. Can we go to the next slide, please? Farm workers was the group that was mostly impacted by the fires, and this was a result of there not being enough education and preparation delivered to the communities in terms of emergency preparedness. A lot of the farm workers and migrant families were neglected from services, or not having access to services, or not having information really led to them not being able to know what resources were available. Also, a lot of them given to the low wages, they have limited access to mobility, limited access to health resources and social services. And something that we are aware, I think all of us are here, is that there are some also structural and institutional barriers that also create a challenge for them having access to services and relief efforts. Not to mention the discrimination. There's also an anti-immigrant sentiment that has been going for years. And as a result of that, the fear of asking or accessing resources continues to be a main issue and a main problem for them to just trust authorities in general. And that includes receiving orders to evacuate. Even that could create terror and fear in the families as to not wanting to listen because they don't know whether they can trust the authority that is relying the information, right? So there was a lot that was happening in terms of that around that time in 2007. And when we look into this historical context, we always take into account how this has led, sorry, the light sometimes goes outside. You're gonna see me do this multiple times. As a result of that, a lot of the work that we do at VCC, if you can move to the next slide, please. As a result of this, the migrant health program that I run at Vista Community Clinic really relies on historical context. We learn from past events, and we ensure that moments in history where the farm worker communities are left unattended, that we really take that into account, and that we include their experiences and their voices when delivering health educational materials to ensure that we are making it as accessible as possible for them. The migrant health program is under a community health department here at Vista Community Clinic. So I always describe it as we being part of a health center, having its clinical arm where the doctors and nurses are the ones that take care of anyone that comes in for any appointments or any medical services. And then we have the community health department, which is more programmatic focus. So we do a lot of we are grant funded. So a lot of the grants that we apply for or that we receive are with the intention of delivering resources, information, preventative health information to the communities. Any other resources that we're able to leverage. The program that I run is, as I mentioned, serving farm workers and migrant families. We offer care management, so that includes appointment booking. That includes if there is a patient that has been diagnosed with a chronic conditions, and one of our health educators kind of supports them with ensuring that they keep up with their medications, with their appointments, that they don't miss any of that. We also run a food distribution, and we also focus in delivering preventative health education, which is kind of what I want to highlight today, or one of the topics. Moving on. Today I'm going to share a little bit about, as I said, one of the efforts that we have been delivering. In 2002, 2022, I'm sorry, we received an EPA award from the Office of Environmental Justice. And the purpose of this grant, it was that we were to create an emergency preparedness curriculum to be delivered to farm workers. But in order for us to be successful in that area, we needed to ensure that we were engaging community leaders, given that they are the trusted messengers in the community, and they're the ones that were advising the curriculum, and we're also advising what were some strategies that we can bring into the space, or what were some tools that we could develop, what were some educational materials that could make it more accessible for the information to really reach the communities and really make an impact. And given that this is, you know, life-saving information, we wanted to ensure that we were making the best with it. We were also expected to conduct emergency preparedness trainings to these farm worker communities, and also share some of our best practices that we learned throughout the curriculum with other agencies, local agencies as well as nationwide. The picture that you see is actually one of part of this development, where we really went to visit some different sites here in San Diego to ensure that we were informing farm workers about what is it that we were working on, given that emergency preparedness had been a huge request from them in the past, right? So as the Migrant Health Program, our task was to identify grants that were really going to focus in us ensuring that we were able to deliver this information to them. So we usually let them know, you know, this is what we're working on. We have this grant coming up, and we're going to have we're going to be conducting focus groups and needs assessments. So just to ensure that, you know, they were aware, but also to engage them in the process to ensure that their experiences were being included. If we move along to the next part, as I mentioned, we conducted different activities under this grant. Some of them included focus groups, presentations, and they were at different settings, right? Some of the pictures that you see here, one of them is at an avocado site where we partnered up with our mobile medical unit, and they were at the site providing COVID-19 vaccinations. And at the same time, because farm workers had to wait that 15-minute after getting vaccinated to ensure that everything was well with them, we took advantage of that time to do 15-minute presentations in small groups to ensure that they were receiving emergency preparedness information. We also conduct tabling events. We also provide information about emergency preparedness. So our team has been at different health fairs, ensuring that they're delivering that information. We also conduct them at classroom settings, so people that are, you know, closer to the area in which we have our health center, they were able to attend those trainings. And the picture that you see to the left-hand corner, is a group of some of our community leaders. So they're the ones that were advising the process throughout the development of the curriculum, but also providing the feedback and the insight into ensuring that we were making this project as accessible as possible to the farm worker community. So they're actually at a plaza where we have noticed over the years that a lot of farm workers or jornaleros, or people that are looking for a job, usually gather in the mornings. So they were out there conducting needs assessments to ensure that we were also collecting experiences and voices from our North County, San Diego, in order to best inform the curriculum development of the trainings. Can we go to the next slide, please? Some of the things that we learned as we were developing this curriculum, and also delivering the trainings and the project overall, is that when we want to reach farm workers, or when we want to serve them, right, it is very important to engage community leaders. As I mentioned, they are the trusted messengers, and a lot of the times they have family members who are farm workers, or they live in the same area and in the same communities where farm workers live. And we also ensure that as we do this, that we're also compensating for their time, their energy, and the effort that they bring forward. We also engage local CVOs. So that means agencies that we partner up with here in the area. We engage a few different, six different agencies. Some of them, one of them works in like the immigration services, providing assistance and information to families in regards to exploring either an immigration relief, or also they also provide Know Your Rights workshops, and they do a lot of different things. We also were lucky to come with the support of an agency from the county of San Diego, also providing really great insight into what were some communication strategies that we could bring to the table. We also engage other agencies that work with different farm worker communities in different areas in San Diego. So it was an effort that really included community leaders, but also local CVOs that were advising the project throughout this time. We conducted focus groups to ensure that we were also hearing from the community directly, from the farm workers directly, and ensuring that their experiences and their voices were included in the development of the curriculum. And as you saw in the pictures, we were also in different parts of the county. So instead of requesting that they came to us, we ensured that we were visiting sites, that we were at different health fairs, that we were at different plazas, collecting that information, and also ensuring that they had access to the services and the information that we were providing to them. A lot of the information that were collected from the needs assessment, from the focus groups, were incorporated into the development of this training curriculum. But also, in addition to that, as we were collecting the information, we made sure that the people that were engaging and providing that information, that not only were they compensated for their time, but they also received a follow-up. So after the curriculum was finalized, we made sure that we contacted the people that participated in the curriculum, that expressed that they wanted us to include them in the trainings, to ensure that they also received that information. In addition to that, we were able to provide emergency preparedness kits, which was a huge request from them. A lot of the times, in addition to providing the information, we also ensure that we have tangible resources available so that it provides more support to our families. At the same time, because this has been, as I mentioned, a huge request from the farmer communities about being prepared in case of an emergency, we continue looking for funding to ensure that we are able to continue providing that education for years to come. This emergency preparedness curriculum is something that our program is adopting. So moving forward, we do plan to continue conducting trainings to ensure that families have the information that they need. And we do this through the scope of preventative health education. Can we move to the next one, please? And now, just to give you an idea, at the end, I have a page where I'm pretty much citing all of the sources that I'm utilizing for this presentation. But just to give you a little insight as to what are some of the things that we deliver to the farm workers whenever we have this presentation to them, we go through this five different steps. And I think some of you are familiar with this. This came from Listos, California. So I think there was this large effort nationwide here in California, where a lot of CVOs from different parts of California were delivering emergency preparedness information to their communities. And the main thing, or the main thing to highlight, or something that we wanted to ensure that families knew, were the 5 steps. And these 5 steps apply to any emergency preparedness, and to any these 5 steps is response to any emergency disaster that they might need support with. And the very first one is for them to sign up for alerts. The second one is for them to make a plan. The step number 3 is for them to pack a go bag. 4, pack a stay box in case they need to shelter in place. And the step number 5, to help others. Now, I'm not going to go through each one of the 5 steps. I'm just going to go over the first 2. But one of the main things that I want to highlight here is that when we deliver this information to the families, we ask, that after the presentation, we say, today could be the day where you can start preparing this in your families. Like, we do not have to wait until an emergency hits in order for us to try to accomplish all 5 steps in that moment, because it's impossible, and we want to make sure that we keep our families safe. So the best practice that the families can do, and that we encourage them to do, is that they start preparing for a disaster now, so that in the future, if there is one, that they are better, they're better prepared, and that they're able to evacuate if needed, or stay, and if they stay in shelter, that they have the resources that they need at home, so that they don't risk going out of their way to get things that they need. Moving on to the next slide, I'm just gonna share what the step number 1 consists of. And something that we go over with the families is that they have to sign up for the free emergency alerts in the county, or with the local officials when they're in the areas that they live. We also encourage them that for those family members who have a cell phone, they could sign up by providing that cell phone number or their home phone. Sometimes text messages. I know that there are also apps that people could download. For the most part, we do not focus on apps, because something that we learned is that a lot of the times, for families that do have a smartphone, or parents that do have a smartphone, sometimes their children are the ones that download, or that created if they have like an iPhone, the children creates their Apple ID, and sometimes they're not able to know what the password is. So it's challenging. So we don't focus on that. Instead, what we do is we break down the sign up for alerts presentation, and we do a like one-on-one step with them to walk them through the whole process of where to go, like what the website is, where to go, where to click, how to switch from English to Spanish, to ensure that they're understanding what the information they're being requested. And we also provide them information about local radio stations that they can also where they can also receive information for people that don't have a smartphone or are not able to sign up for any alerts electronically. And we also encourage them to get to know their neighbors, which is very important in this advocacy and this work that we're doing, that to ensure that they're connected to their neighbors, to their families, so that if an emergency hits, that they have that support system available for them. Moving on to the next one. We also encourage them to make a plan ahead of time. And once again, when we say make a plan, we don't say make the plan the day of the emergency, but rather start now, so that little by little you get the things that you need ready, so that in case of an emergency you have a plan and you know what to do. We encourage them that if they have family members that need any electrical medical devices, that there's a plan for them, that they have battery power radios available at home, that they have a map, and that they have that they identify 3 different exit routes in case they need to evacuate. In our communities, for the most part, we are aware that sometimes churches and schools are the ones that tend to provide shelter whenever families need to evacuate. So we encourage families to be aware of their surroundings, to know where their home address is, and where is the closest church to them, or where is the closest school to them, because it is likely that that's going to be a place where they are likely to shelter in place, to evacuate to, or also, the next city over. And we encourage them to always think about what are some 3 different routes that can get them there, and to ensure that all of the family members are aware of that. To choose a familiar place where they are going to meet in case they need to evacuate. But we also very, very much encourage that they identify a family member outside of their county or their state. And this someone is supposed to be the main point of contact. And this person, given that it is very likely that they're not going to be dealing with an emergency at the moment, they're going to be attentive to their phones, and everyone in the family that is trying to evacuate, for instance, is going to have the contact information of this family member outside of the county or the state. And everyone is supposed to call this person to ensure that everyone gets the same message and everyone gets safely to the location that they need to.
Daisy,
Yes.
I'm so sorry. And this is such important and interesting information, but
Thank you,
we
Becca.
have just another minute or two and then we'll have to.
Okay, yeah, if we just go to the next one, I think I'm almost can we go to the next one? And this is just to ensure, like I said, the plan is that they know in advance so that if they need to evacuate, they do it right away. So prepping in advance to ensure that they're safe. Moving on, I think the next one is it's for them to be prepared, for them to have a plan ahead of time and to listen to warnings and to be able to coordinate with their families and community in general and to share the information. And I think this is all that I had. Yeah, and that was the reference page I was mentioning earlier.
Daisy, this was so great. Thank you so much. Really important and interesting information. I know we're running a little bit tight on time, so I want to move on to resources, but I saw there are a number of questions in the chat, and I wondered if Daisy, you and also Dr. McMurdo could go into the chat and respond to some of those questions. And if we have a moment at the very end of the webinar today, we can highlight some of those questions and your responses. Next slide, please. Great. So so we have some different resources to share with you today. For more information about wildfires and their effect on agricultural and outdoor workers, visit MCN's Wildfires page, where you can download various resources. Next slide, please. Some of MCN's resources include the Spanish language comic book on respiratory health, which they were able to produce with support from the Thoracic Foundation. It's really
Becca,
cool. So please.
can I interrupt you for 1 second?
Absolutely.
I did want to highlight that we have some amazing folks on the call with us today, and a lot of really important links are being shared by our colleagues, and particularly on a do-it-yourself air filter. And so what I would like to suggest that we do is we will compile the suggestions in the chat, and we send out information after this. And so some of the resources that are being shared, we will reshare with you. So I just wanted to make sure that as we're talking about resources, we're aware of the great ones coming through.
Yeah, no, thanks for that, Amy. I was noticing that in the chat too, and that's always the best way to learn, is learning from each other. So thank you. So next slide, please. You can also connect with MCN by going right to their website, www.migrantclinician.org. Next slide, please. Farmworker Justice also has a number of useful resources right in the Resource Center, and you can find that at www.farmworkerjustice.org. And you can also connect with both MCN and FJ through various social media platforms. Next slide, please. Great. So please take a few minutes to complete the post-session evaluation. We'd really appreciate that. If you would like to receive a certificate of successful completion, then submission of the evaluation is required. And thank you so much for attending the webinar today. We really appreciate that. We do find ourselves with an extra few minutes, so I would love to just flash back for some of these great questions that were in the chat. And then we can say goodbye to you all. So we can open this up to both you, Daisy, and Dr. McMurdo. Let's see, sorry, just backtracking, so much information in the chat here. What would you tell farm worker employers to better protect farm workers? That might be a great question for you both, and then we can close down from there.
Daisy, do you want to take first, or should I?
Yeah, I can speak from our experience. I think that we are very lucky to have in our team two health educators that have been with us for over 30 years, and over the years they have developed a great partnership with growers. And what we have done is sometimes they request that we ourselves deliver information to them as employers to ensure that they are providing support to their workers. So I think something that has worked for us, building that partnership with the growers and themselves, and that provides the support for farm workers.
I think that's really important. I think the other thing I would share is, the challenge with a lot of our air quality monitoring is it's not actually that accurate in rural areas. And the wildfire smoke can be a lot more intense and a lot more severe in the areas where farm workers are working. I think one really cool thing that's getting a lot cheaper is this low cost and sort of cheaper PM2.5 monitoring that you can actually buy and purchase yourself. And if you have an employer who actually really wants to be proactive in preventing farm worker, like improving farm worker health, actually getting them to buy a monitor, they're about $100, and installing it in the central area is really helpful to kind of figure out what the actual air quality is in their area so they can plan for that.
That's great. Thank you so much, Daisy and Dr. McMurdo for answering the question, but also for presenting with us today. I think that we all learned so much and are leaving this webinar feeling certainly more informed, but also more inspired in the work that we do. And so thanks to all of you for participating today.
Becca, we have 4 minutes left, and I am just going to be a little pushy, and I'm wondering if we can get Daisy or Maeve to answer Casey's question about what you're hearing in terms of farm workers' interest in wearing an N95 respirator, because that is an important recommendation, but we also get some pushback in terms of willingness to wear that, particularly when it's really hot. So we're wondering, in your research, or Daisy, in your outreach, like what you're seeing in terms of response to that.
I agree. I think it is really, really hard to wear a respirator. Like, I was a physician during COVID-19, and wearing an N95 plus PPE all day in an ICU, you feel it and it's miserable. I think the challenge is that a lot of the time the respirators too aren't necessarily fit to the farm worker. They're kind of given a one size fit all and said, hey, put this on, without a lot of training about how to wear it. I think if you can kind of get the buy-in and get the training and talk through how to use it, it does help farm workers to feel more confident in knowing how to wear it and knowing kind of how to make it more comfortable, because there are some tweaks you can sort of do with how you're wearing it to make it more comfortable. But also the challenge is, again, a lot of time the masks don't fit that well. They're not the best protection. The best protection is not being exposed in the first place. And if you're already hot and getting heat stress and then you can't drink water and you're wearing a mask that doesn't fit well, it's not a great combination. So I share the challenges, Casey. I'm not sure that N95s are the best solution. I think the solution we've got right now, but I don't think we can stop there. I think there's more work that's needed to think about how we actually provide kind of more holistic protection for farm workers beyond N95s.
Yeah, yeah, it is definitely a challenge. Because like I said, it doesn't fit all of them the same. So there needs to be, it's always a challenge, I honestly, but something that we have done is every time that we deliver information about the importance of something, we ensure that is the education component of it, the education plus maybe like a small tutorial on how to wear one, but also reminding them of the importance of protecting their health. A lot of them are parents of families of small children, so we always rely on that and ensuring that they understand that they're not only protecting themselves, but also the health of their children. For the most part, I think that's what does the trick, like reminding them of protecting their families. And we go back to COVID, right, and how at the beginning there was a lot of miscommunication or misconceptions about COVID, but nonetheless, our team worked really hard in ensuring the families were receiving the accurate information regarding COVID. And up until now, we still see families that are masking because of that. So I think just reminding them of the importance of taking care of their health and their family and how they protect their families as well.
That's great. Thanks both of you again for answering that question. And we're at time now, so we'll say goodbye and thanks to all of you for attending today.